sometimes you think it's all roses and sunshine. And once you get into a situation, it turns out to be, a horror show. And so I would recommend that you have a lawyer look at the agreement up front and tell you what things are problematic.
Welcome to How I Doctor, where we're bringing joy back to medicine. Today, we're diving into part 2 of my conversation with Dr. Glenn Loomis, where we'll tackle employment contracts. We're covering the red flags to watch out for and sharing negotiation strategies to help you secure the best terms, even if you're planning to stay right where you are. Glenn is a board member at KVLR Capital Partners, focusing on acquisitions in the healthcare space, as well as Chief Medical Officer of Dapper Care, a startup that combines telehealth and AI to make high-quality, affordable healthcare accessible to everybody. From the highest level, whether a doctor is negotiating with their current employer or they're looking at a new opportunity, do you have a list in your head of like the most important items they should look out for when they're looking at a new contract or a renewal of a contract?
There are a list of things that we can do and that we should be looking at in contracts. Some are very obvious, right? Things like salary, benefits, time off, hours, call arrangements, all that kind of stuff. But sometimes those are the things that are sort of the least important when it comes to really how you're going to use a contract. Because remember, a contract is meant to be negotiated and then put in a drawer and never seen again, right? It only comes out if there's a dispute. So contracts are really only for if there's a problem at the end of things, right? And so in those cases, then the less obvious things are the things that come out and bite you. They are things like term and termination provisions, like use of an arbitrator versus going to court. Intellectual property rights if you're in the type of practice where you might be inventing something. Confidentiality clauses, non-competes, attorney fees, those kind of things. All of those kind of like nitty gritty, I call it the legalese. Those are the things that really ultimately matter most when you get into a dispute.
It almost seems like if you are more worried that this may not be a good fit for you, you should be even more cautious about those things, like if it's going to be an arbitration, what the IP situation is going to be like, because like you said, it's when things go sour that you pull out the contract and see what you signed and agreed to on both sides.
I would tell you though that sometimes you think it's all roses and sunshine. And once you get into a situation, it turns out to be, a horror show. And so I would recommend that you have, you have a lawyer look at the agreement up front and tell you what things are problematic. Most contracts are pretty standard. They're pretty boilerplate and they pretty much say the same things. But some of them have these little poison pills, and good lawyers know, good HR lawyers or good health attorneys know what those poison pills are. And so they're going to look for them and they're going to point out to you, hey, this is a pretty good contract, except it's got this one clause in here that is really problematic. Now, you may or may not be able to get that changed. We can talk about that. But at least you'll know what's in there and where the poison pills are. Or sometimes they're going to come back to you and say, I wouldn't sign this with it, regardless how much money they were paying me. This is a terrible contract. It's totally one-sided. That tells you something about the organization as well, right?
Yeah, I was just going to ask, say your lawyer recommends you cross out one of the terms or change it to 30 days instead of 90 days. Do you have a sense of how commonly those modifications are accepted by an employer? Are they totally fine with it? Or is that going to, they're going to put their foot down and say, nope, this is the standard contract. We never change things. Most people say everything's negotiable, but is that true with employers of doctors?
I would say that's not really true with employers of doctors. I would say that in general, if you're going to be part of a 4-man group somewhere, then almost everything is negotiable. If you're joining a big for-profit, ED group, they're going to give you the contract and say, take it or leave it, right? Or if you're joining me in a 500-person medical group owned by a health system, I'm going to tell you that the boilerplate language at the front, I'm not changing anything in it. But the appendices that have things like what benefits you have and those kind of, like, there is some wiggle room there usually, but not in the boilerplate language, because everybody in the whole group has that. And if I change it for one, I'm gonna have everybody at my door saying, well, you changed it for Joe. Well, he wasn't supposed to tell anybody. Well, they always tell somebody. So,
Yeah.
it gets out. And so, you can't have that. So you ultimately have to hold your ground on certain things.
Yeah. So for the larger group, most of the contract's going to be pretty boilerplate. Probably not many or no changes will be accepted, but some of the nuance maybe around the work that you and your specialty is doing that's maybe controlled locally or by the chief level is probably up a bit more for negotiation or modification.
Exactly. If you want to say, like, hey, I just want it stated in here that if I have to do call more than 1 in 4, I'm going to get extra pay for that. That's a perfectly legitimate thing to ask for, right? Because, my experience is, like, I used to have a rule in the medical group, like, if I have one of anything, I have to have four of them, right? Because more call than 1 in 4 gets to be pretty onerous for people. And so sometimes I only had two of those, but then I'm paying those people extra because they're doing extra call, right? And so there are things like that you can negotiate. You have to understand that the boilerplate probably is not. It's still good to have your lawyer look at it and point out where there are problems, or where there are potential problems. So at least they're there, but you should be realistic about whether you're going to get any satisfaction from pointing that out to the other side.
I like that call example. You could imagine a contract might say, you're on call one every 4 weeks or something like that. And a lawyer might point out, hey, it actually doesn't specify what happens if you're on call more than that. And so just having little extra what if scenarios, I think that's probably an area where a lawyer might be able to help advise you too, especially one that looks at physician contracts frequently.
Yeah, absolutely. Or even whether it's in the language of the contract, it allows them to say, well, I know it says 1 in 4, but we need, because of need, you have to do more than that. And oh, by the way, we're not going to pay you extra for that, right? Like, all of that comes together. Part of it might be in the boilerplate, and part of it might be at the end. So you want to make sure it all is covered.
Yeah, that makes sense. Glenn, let's talk a little bit about non-competes. They're a constant topic of scrutiny in medicine. In some states, like here in California, they're just not permitted at all. The FTC and Commissioner Khan have been talking about them a lot. And even, there's some rumors about carve-outs in healthcare, unfortunately. Are you seeing that continuing to be a common issue, a common standard clause in many contracts?
Yeah, it's still, it's totally state dependent, and it is still pretty common in many, many places. I will say that because of the FTC ruling and then the overturn by the courts, and now it's on appeal again. So it'll probably take us 2 or 3 or 4 more years to know how it's really going to shake out. At the moment, I think it's totally up in the air. And I think even if you have one, your organization is probably going to be a little bit loath to enforce it, because we don't really know if later on it's going to come back and they're going to say, well, it wasn't enforceable and now you owe this person a big chunk of money. It's probably one of those things that if you decide to leave somewhere, you should just sit down and talk with them and say, okay, let's have a talk. I'll agree not to, poach Mary Sue and all my old patients, but I'm going to set up shop across the street. And if they happen to come to me, then that's, I'm not going to take the list, but if they come across, then you're not going to come after me for that. There are ways to get around these things. Even in physician groups where we've been totally run by the physicians, they still want non-competes because they don't want to train somebody up, especially specialists. Specialists don't want to train somebody up and then have them go across the street and compete, right? And so it's a tough conversation to have. But I think right now, from a legal perspective, it's really up in the air.
It's a great point. We often think of maybe it's the health system or the health insurer that, wants to make very challenging terms in a physician contract, but sometimes it's just another physician that wants that too.
Yeah, absolutely. If you look at big single specialty groups, some of them have the worst, contract terms because, again, there are certain things that give them an advantage.
Ever feel like everyone else in healthcare is making money hand over fist? while doctors are the ones always getting pay cuts? That's where Offcall comes in. At Offcall, we're helping doctors take back control of medicine. The next time you're asked to see more patients in less time, or forced to submit yet another prior authorization for your patients, Offcall is here to help. Visit offcall.com and sign up today to join a community that's putting doctors back in control of their careers.
Glenn, let me ask you one more contract question about renegotiation. I've been at my job for over a decade now. But when it comes to renegotiation, are you seeing physicians saying, "Hey, I've been here 5 or 10 years. I'd like to renegotiate my contract, or I'd like to renegotiate parts of it," or are people just kind of sticking with what they've had for a long time and not pulling the contract out and looking at if there are ways to renegotiate parts of it?
I think people do try to do that. Again, I think you're sort of stuck a little bit with what the group, again, with that size issue. The flip side of that, though, is I would say that it comes down to how valuable are you, right? Like again, if I'm running a group, if you're one of my top performers, you're a top producer, you have highest quality, you have great patient satisfaction, I'm going to probably give as much as I can to you because I want you to stay, right? If you're always the lowest productivity and your patient's, satisfaction is the 10th percentile, I'm probably going to just say, sorry, Charlie, on that one, right? And so it really does depend a little bit. I will say, though, that my experience and my belief is that physician compensation plans are typically good for only about 5 or 6 years anyway. If you look at all big groups, they go through a revamp of their physician comp about every 5 or 6 years because by then the docs have physicians are really smart people and they're especially smart at figuring out how to
Yeah,
get the most pay
human
for the
nature.
least
Yeah.
amount of work, as we all are, right? We should be, right? And so yeah, right. And so they're really good at that. And so by the time 5 or 6 years goes along, everybody has tweaked out their practices so much to take advantage of every little loophole that you kind of have to go back and say, okay, we're going to redo this a little bit. And yeah, so so I think that this sort of renegotiation happens on average in most organizations every 5 or 6 or 7 years anyway, without you actually having to even kick it off necessarily.
That's interesting. And then the organization is trying to essentially find a new recalibration or a new way to reset. They're probably not trying to give people a massive pay cut across the top, but they're trying to kind of reformulate things so that I would imagine the employer is trying to kind of slow the rate of growth of pay in response to all the little loopholes and the changes to Medicare billing and RVUs and everything that have changed over the past 5, 7 years.
All of those things. And also, I think it really comes down to, I think most organizations truly, even if they don't appear to on the surface, they truly do want to try to pay people fairly, at least fairly across the group. And so sometimes, like whatever happened within Medicare, for example, the specialist might be getting paid way more now than primary care, and we got to do a makeup to figure out, or we're going to lose all our primary care docs, or vice versa. Like, there's all kind of reasons why these things get kicked off, but it usually comes down to some fairness of how things are split in the group.
Yeah, and I would imagine any good physician HR benefits person would be trying to focus on the fairness of it. There's lots of ways you could, of course, define fairness, but trying to make things seem as equal or as fair as possible. Otherwise, you're going to have your doctors revolt and walk, and you won't have any doctors left that'll work for you.
Yeah, in any compensation plan, you have to do two things. One, keep it internally fair between all the different parties. And two, it has to be fair in the marketplace, right? Like if everybody in my organization is getting paid 20% less than across the street, I'm going to have nobody left. I mean, eventually you have to be within a range. You can be a little less or a little more, but you can't be way out of whack. that fairness issue in both regards has to be in balance.
Yeah, it's that internal and external benchmarking piece.
Yes, absolutely.
A big thank you to Dr. Glenn Loomis for joining us for part 2 of this insightful 3-part series. In our final episode, Glenn will dive into everything you need to know about interviewing for a new role and ensuring it's the perfect fit. You won't want to miss it. Stay tuned. If you want to learn more about the ways doctors should rethink their finances, visit offcall.com/podcast. Make an account on Offcall to confidentially share your details about your work and sign up for our newsletter where you can hear more about the latest trends we're seeing in physician pay. You can find How I Doctor on Apple, Spotify, or wherever you listen to podcasts. We'll have new episodes weekly. This has been and continues to be Dr. Graham Walker. Stay well, stay inspired, and practice with purpose.